Nigeria has a population of nearly 200 million people, but despite it having plenty of agricultural resources and oil exports, the wealth is not always equally distributed among the population. In rural areas, up to 80% of the population are living below the poverty line, which is less than $1.25 per day.
I was born in Nigeria. That's where I grew up. In '74, I decided to come here in America. And my academic years and career-wise has been here in the United States. Healthcare in Nigeria is fragmented. You could see big hospitals in the big cities, and in the villages, you hardly have anything.
Dr. Onyebaki returned to his home village, alongside some of his colleagues, to provide healthcare to those who do not have access.
I'm from Nigeria, went to high school there, came over here. It was right after I graduated from medical school, so it was like full circle, coming back home, and that was the first thing I did right after graduation.
I went to a particular village in Nigeria where they don't have electricity, they own running water available to them in their homes. Healthcare in the village where I went to is terrible, poor.
If a typical Nigerian is sick, the first thing they usually would think about is going to the nearest drugstore. When they go to a drugstore, it's not necessarily a trained pharmacist that's there. It could be someone who just opened up a drugstore and is selling medications. And of course, number one thing on the drugstore owner's mind is making money. So they can give a diagnosis just over the counter saying, oh, you have this, here's a drug, go take it.
The most common illnesses found in villages like Achi are hypertension, diabetes, and general infections. Unfortunately, many Nigerians, like this woman, suffer every day with these manageable illnesses.
Hypertension?
Infection.
Okay, infection?
Yes.
Where?
About 3 or 4 years old.
Oh, okay. And what about the girls?
He's not eating.
He's not eating?
Most people from Achi are not exposed to modern medicine. The nearest hospital is probably about 5 miles away. Two things prevents people from going there: lack of resources to go, and when you get there, they don't have much to take care of the individuals. They don't have medicine. They don't have equipment. They may not even have physicians there. So that leaves them with one option: either to have to do nothing or to travel, about 45 miles away to the nearest city.
This 87-year-old woman is about to make the long journey on the back of a motorbike just to receive basic health care.
We usually use elementary schools, set it up like a MASH unit. It dawned on me that education is probably the best thing you could teach. We usually see close to 2,000 to 3,000, patients over the course of 10 days.
You show up at this place, and there's just people everywhere, trying to organize, get the lines. Well, you think people are lining up for food. You think we're giving away free food. There is no food. And it's because he wants to see a doctor. Because he has pain, he wants medication. He can't see, he needs his eyes to be checked. Volunteering is like a soul therapy. You're taking something of yourself, because your time that you can use for anything else. And you're saying, I am going to do this for this person. I am going to give back something to the community. I'm going to give back something to humanity. No matter who you are, where we are, the number one thing that we all collectively feel is health. No matter how rich. If you have a heart attack or if you feel sick, the first thing you want is a doctor, no matter if you are in Nigeria or if you're in California. But when it comes to healthcare and to spread for everyone else to have that privilege, it is not so.
One twice a day if you need it for pain. Vitamins, one every day. Okay? And you're welcome.
We're not politicians. We can change. Usually these things have to happen from policy standpoint. But what could we do as individuals? And how could we change what we do as nurses or doctors? My goal, what I foresee, is that, could imagine we have this group of people who go there, what the impact it would have, because it is a controlled, combined effort, and we can do so much more. Why not help? No matter in what aspect we volunteer in. You don't have to, they said you don't have to travel out of the country. There are different groups that we have here on Long Island or anywhere else, church, community, hospital. So I advise everyone to give a little, get involved.